Okay, get out your paper to like track your ABCDs and be ready to show your answer or like commit to an answer with these questions. So, a 50-year-old male presents with episodes of edema, shortness of breath, and uncontrolled hypertension. Okay, so that's your patient vignette. Changes in blood pressure are sensed by baroreceptors in the carotid sinus. The carotid sinus is innervated primarily by which nerve or structure? All right, lock in your options. If you said glossopharyngeal nerve, you are correct. It's technically a small branch of the glossopharyngeal nerve, the carotid sinus nerve of Herring, but glossopharyngeal nerve would be sufficient for NCLEX exam. Okay, same patient. Ion channels play a key role in stabilizing blood pressure. What is the principal cation found in intracellular fluid, which is beneficial for the treatment of hypertension? Well, like, let's just get rid of some things right now, right? Sodium is extracellular. Calcium is also going to be extracellular. That's why if a calcium channel opens, calcium rushes into a cell. Zinc is, it is a cation, but mineral, really more for immune system. So we are left with potassium, and it is also used to treat hypertension. Same vignette. In addition to increasing sympathetic output and mineralocorticoid secretion, how does the ROS, the renin-angiotensin-aldosterone system, elevate systemic blood pressure? Well, does it increase blood volume? Does it decrease sodium retention? Does it decrease ANP? Does it cause direct systemic vasoconstriction? How does the ROS elevate systemic blood pressure? Well, there are kind of two correct answers here because we do know that with the ROS, it is going to increase blood volume, right? We're going to bring more water back in along with sodium. It's not going to decrease sodium retention, it's going to increase. It's how water follows along. It doesn't directly decrease ANP. ANP is just not released, and ANP lowers blood pressure. And then because it said in addition to increasing sympathetic output does what? Well, sympathetic output is the vasoconstriction, right? Like that's part of the big process of vasoconstriction. So while it is doing some direct systemic vasoconstriction, that's already listed here. So it's saying besides that, besides what the sympathetic system does, how else does the ROS elevate systemic blood pressure? Which is why A is the best answer, but these are technically two correct answers. And then lastly, when released from the vasa recta of the kidney, which protein initiates the angiotensin cascade? Well, the protein that initiates that process or the hormone is renin. Renin comes from the kidney. It initiates that process. It's going to convert angiotensinogen, which comes from the liver, not the kidney. It's going to convert that into angiotensin 1 and then ACE from the lung and some kidney and some liver. It's going to convert angiotensin 1 to angiotensin 2, right? And then that's going to be the active molecule that does all the things. Awesome job if you got 100% great. If not, that's fine. This is just connecting kind of pathology to physiology, right? That's all we're doing.